Welcome, everyone. I just want to welcome you to Integrative Health and Wellness today. Before we get started, my name is Mary Starr Carter. In just a few minutes, I'm going to introduce our guest speaker today who came. She's a little under the weather, but she wanted to be here with you because she knows how important this is. She's helping women all over Florida, and I am a recipient of that as well. So let's talk a little bit about pelvic health. First of all, I want to welcome you to our office here at Integrative Health and Wellness. I myself rent a space out of here. I've been helping individuals since 1999 in the natural health and wellness space. And I am an expert in essential oils, as Kathy went to one of my essential oil classes last week. But I had the privilege of many years when I had just become a chiropractor. Actually, I was still in chiropractic school. I got to work with a nurse who specialized in women's health. And she did a technique called Arvigo massage. And this originated in Belize. And in Belize, if you were growing up there, your mom would teach you how to care for your uterus in your body. I'm sorry. Did you say your mom? Your mother would, okay? And it's a simple, we're talking about Arvigo massage. I don't know if you've ever heard of it. It's a simple massage where you are literally just rubbing your belly. You'll see a lot of these women just rubbing their belly. And what that does a lot of times through life, and you know this too, right? The uterus falls forward, it falls backwards. We get constipation, we get overactive bladder. And so I learned this as a chiropractor or through chiropractic school. And then I would have patients come in who had UTIs all the time. And I said, well, let me feel your belly in here. And sure enough, that uterus would be smushed down and pushing down on the bladder. And I taught them the simple belly massage. A lot of times the UTIs would clear up. They felt so much better. Their periods were better. So that was kind of my first introduction with women's wellness. And there was a lot of great fertility stories from that too when I was working with this nurse, right? So in this culture in Belize, they believe that the uterus is like the hub of your health, like all of health. So I think as women, I don't know about you, but when I grew up, I got all my knowledge from school, and that was about it. My mother's generation, right? My mom's about 72. I don't think they even knew anything about lady parts, they didn't. And it was just kind of suck it up. And if you're in pain after birth or, any of these things. So I kind of had this awakening in the early 2000s. In 2010, when I was really seeing patients, this is when I started hearing women's stories of, oh, when I'm lifting things, I feel like something's coming out of my vagina. And I was like, oh my goodness, this was when I learned about vaginal prolapse. And I worked with a lot of hairdressers at the time, women who had worked on their feet all the time. And they ended up with a lot of weakness in the pelvic area. And this is when I first learned of pelvic floor therapists. And every woman in town went to the pelvic floor therapist up in Crestview, Florida, who had pelvic floor dysfunction. So this was women in or over 50s. This was women who just had babies. But it was really, really important. And I think we all know someone who has overactive bladder, has had painful intercourse, maybe after having a baby, has had vaginal dryness, all of these things. So fast forward to just a few years ago, I myself was struggling a lot with the changes of going through menopause. And I was struggling with vaginal dryness and just discomfort. And I thought, oh my goodness, my vagina is going to be fun. Like I was really nervous, right? So this wonderful woman came into the office one day who I had heard great things from our chiropractors as well. Dr. Gabi, I'm going to hand out some of her material as well for you all.
It's hanging on my board. Like, do that.
You got to do that. You got to do that. And we just ran into each other at the office, and I said, I was so excited. It was like seeing a movie star because they are very rare. what you do is very rare and it's very important. And so my story, I got to come for a full exam and I videoed all of it for you except the inappropriate parts. So you could see and walk through. So anyone who's registered today, because we can't do a whole lot in an hour, but you can see the whole process, including the orthopedic exams, is because my problem, a lot of what I had going on was a lot of hip pain, musculoskeletal dysfunction, and then a very simple solution to what I had going on. So I was so relieved, and it was just so worth the investment to see a pelvic floor therapist. So I actually, one more thing, Dr. Gabi, I want to talk, or why don't you talk, and then I'm going to talk about foundational nutrition, okay?
Sure.
Then you can see how far your voice
Yeah,
left. So let's bring out Dr.
absolutely.
Gabi in here about pelvic floor therapy.
Hello, everybody. Welcome. I'm so glad to be here. My name is Dr. Gabi. I am a physical therapist. I am a pelvic floor specialist. I have been a physical therapist now for almost 8 years, which is insane to think about, that it was almost a decade that I graduated from PT school. And then I have specialized in the pelvic floor for about 5 years now. So I've been a pelvic floor specialist for about 5 years, and I will never go back. I love the pelvic floor. I love treating women. Obviously, everybody has a pelvis. So, children have a pelvis, males have pelvises, females have pelvises, but I choose to specialize just solely in women's health because of the joy, the satisfaction that it brings me personally to know how I am transforming individuals' lives after they have babies, whether they are pregnant or postpartum, or whether they are going through menopause or perimenopausal or postmenopausal. There's so much that we can do to help with the pelvic floor. So what is the pelvic floor? First of all, let's start with that a little bit. Let's start with some anatomy. So here, I'm going to take out the organs. So don't mind me as I kind of take out these little organs here. We'll go over those in a second. But for those watching the recording or the video live, here is your pelvis. And then for those that are here with us today, if you take your hands, I'm going to actually set this down for a second. So if you take your hands and you start with them right at your rib cage, everyone in the room do this with me if you don't mind. And then if you kind of shimmy down until you get to a soft, squishy part right in the middle, that's your tummy. And then you keep going a little bit further, you're going to end up on 2 bones right there, okay? And those bones are your ilium, and they specifically, what you're feeling, are called the iliac crest. Think of those as part of the ring that forms your pelvis. These 2 bones right here, if I'm going to bring it close to the camera, these 2 bones are the very bottom of your lumbar spine, of your low back. And then you've got your sacrum and you've got your tailbone at the very bottom. So we've obviously have our back. And then if we take our hands here, actually, if you're either in the room or watching this, you take your hands in the front and you go to the front of your pelvis and you go all the way to the very, very pointy little bone there. That's your pubic bone. Then if you take your hand from the back and you go kind of through the glutes and all the way down, you're going to end up feeling your tailbone. And so to show you on the model here, here is your pubic bone. So this is where each half of the pelvis comes together. So pubic bone, and then that little pointy bone right in there is the tailbone. Okay, so we've got pubic bone here, tailbone here. I know you know this like the back of your hand, Dr. Mary Starr, but pubic bone here, tailbone here. And then everything that you guys can see in the red there, okay? So everything that's red are the muscles that make up the pelvic floor. Now, these muscles are extraordinarily important because they provide so many wonderful functions for our bodies. They provide support of our pelvic organs, number 1. So pelvic organs, what are the pelvic organs? Does anyone want to take a guess for those that are here in the room with me today? Anyone want to take a guess as to what organs are in the pelvis? I'll give you a hint when you have the, oh yes, go ahead.
Uterus.
Uterus, absolutely. Uterus is a huge one. Yes, that's 1 out of the 3. Perfect.
Bladder.
Bladder.
Okay.
Cervix, absolutely. It's connected to the uterus. So yes.
Oh yeah. Okay.
Yes.
Yeah, it would be, wouldn't it?
Yep. No, you're 100% correct. And you know what? The cervix, actually, when Dr. Mary Starr was talking about prolapse, pelvic organ prolapse, the cervix is one of those parts that can actually come down and prolapse. And you can sometimes literally see the cervix when you're doing an exam and someone has uterine prolapse, which is when the uterus starts to come down through the vaginal canal. So we've got bladder. So I'm going to show the camera here. So here is our bladder. There's a little model. This is not true to size. Yeah, it might feel like it. Right. But no, it's not true to size. This is actually a lot smaller than our typical bladder. Here is our vaginal canal. I'm gonna see if I can catch the light here. So vaginal canal right through here, cervix, uterus, fallopian tubes, and then the little ovaries at the very end there. And I'm gonna go around so everyone can see that, okay? And then we've got one more really important organ in the pelvis, and I'll give you a hint. What do you think happens to, or what organ would be responsible for helping us use the bathroom? Number 2. It's our rectum. So our rectum is another one that lives inside of the pelvis. So our large intestine, we have on the right side, we have our ascending colon, our transverse colon, our descending colon, and then we have something called the sigmoid, which is just a little curvy part, and then it dumps right into the rectum. So once again, with pelvic organ prolapse, sometimes the rectum can kind of push into the back wall of the vagina and it can cause a prolapse, or it can be a prolapse. And then that's when sometimes people have constipation or they have difficulty emptying their bowels when they're having a bowel movement. And that could be potentially because of something we call a rectocele, or the rectum is kind of pushing into the back wall. Same thing can happen with the bladder. The bladder can also fall into the wall of the vagina. And anatomically speaking, if we think of this is the front of our body, this is the back of our body, the bladder lives first. So the bladder is tucked right behind the pubic bone. The vaginal canal is next, then we've got the uterus on top, and then behind that we have the rectum. And so these things can kind of shift in different directions essentially here. But that is the number one, or I should say that is just the first function of the pelvic floor, is actually supporting the pelvic organs. The next thing that the pelvic floor does is it has sphincteric function, which means it squeezes when we want it to squeeze, and it should relax when we want it to relax, which means that when we are having the urge to pee, we should be able to cough, laugh, sneeze, run, jump, lift a heavy box, lift our kiddos, whatever it is, our grandkids, without having to worry about leaking. Sometimes this still happens though, and that can be because of pelvic floor dysfunction. Sometimes especially not even necessarily just the younger people, but sometimes those that are a little bit older can have this too. But sometimes pain with intimacy can be a reason or a sign of pelvic floor dysfunction. If these muscles are too tense, they're holding on too tightly, they're not relaxing when we need them to relax, that could cause a lot of trouble with intimacy. Constipation can be another thing that can also be something that could go wrong. There's many different things, which we'll go over here in a second. But essentially, pelvic organ support is very important for the pelvic floor. Sphincteric function, sexual function, which we touched on a little bit as well. Something called sump and pump, which just refers to the lymphatic system. And so the pelvic floor does have a lot to do with lymphatics as well. And then postural support. So our pelvic floor should work automatically. So we should not be telling our pelvic floor all the time, hey, you do this, you should relax now, you should contract now, you should just chill. It should be doing this automatically as we live our life, because we really shouldn't have to worry about it. But sometimes we have to retrain the pelvic floor, and we do have to actually put in some intention into the pelvic floor so we can get it back to where we want it to be. Let me stop there. Does anyone have any questions so far?
That was good.
Okay.
Yeah.
Not yet. Okay. So let's talk about what could possibly maybe go wrong. So, well, actually, even before we do that, let's go over a little bit more of anatomy. So, I'm going to start here at the camera, and then we'll go from there. So for everyone that can see this, right here, that little yellow spot right there, that's the sweet spot. That's the clitoris. Below that, we have our urethral opening, which is where urine comes out of. Below that, this is our vaginal opening. And all the way below that is our anal opening, which is where gas and stool are released. So obviously we have this for gas and stool, this for sexual intercourse and for giving birth to babies, and this for urine to be released. So we've got these 3 openings, okay? So up here, and you know what? This is actually something that a lot of people don't even realize. Like, I don't know if any of you have ever seen sometimes these videos go viral, but sometimes there's videos where people ask, like, how many holes does a female have down there? And some people genuinely don't know. So there's a lot of people will say 2 holes. They think vagina and anal, or anus, and the opening of the anus, or the opening to the anal canal. But sometimes we don't even realize that we have a urethra. And another thing too that I want to touch on, which is, I think, I see this range a lot within my office. So I see younger individuals that sometimes struggle with this, and I see sometimes older individuals that struggle with this. But it is actually very important that we look at our vulvas, and our vulva just simply refers to everything we can see from the outside. Okay, so that would be the mons pubis, which is this kind of fleshy, squishy part right here over the pubic bone, and then the outer labia, the inner labia, and then essentially the perineum, which is just the space in between the opening of the vagina and the opening of the anal canal. But it's important to actually observe what's happening with our vulvas, because sometimes if we have hormonal changes, if we're on birth control for a long time, or if we're around menopause, sometimes things start to change. Yeah, I'm getting some head nods here. Yes, because of the changes in the levels of hormones in our body, or sometimes there could be a skin disorder going on, or there could be an infection going on. And if we don't know what our baseline is, then how are we going to know when something is off? And so this is something that I do with my clients in the office sometimes, is like we'll look at their vulva together, because, they may have a concern. Hey, it looks like this. Is that normal? And I tell them, yes, that's normal. Or, you know what, actually that does look a little bit irritated or red. Let's have you go back to your OBGYN and have them take a look at it. Oh, I got a question here.
I think we're going to take question. Oh, wait, hold on one second. Lisa was going to send it to me. Hold on.
Okay.
So that I can ask them. No. Okay. So we'll wait just a little bit.
Okay. No worries. No worries. Okay. So yes, let me see. And then a couple different things to talk about as well are what can be common issues of pelvic floor dysfunction that we may experience. So I'm going to start with bladder first. So who here, whether you're virtual or whether you're attending live, who here either knows someone, or maybe you personally have experienced this, has ever accidentally peed a little bit with coughing, laughing, sneezing?
Yes.
Oh, look at that. 100%.
Yes. Sitting down.
Yes. Oh no, yes. Yeah. Getting up, sitting down, all the things, right?
If I pass the toilet.
Yes. Forget it, right? Okay, so that is a very common one. And that just speaks to how common these dysfunctions can be. And a lot of times they're not talked about. And the thing is that there can be so much shame and embarrassment and stigma about these female issues that we experience. But here's the truth of the matter, is that I always say this at every presentation I give, is that number one, there is hope. Number two, there is help out there for you. If you are experiencing any form of problems, know that there is help there, and you don't have to suffer unnecessarily. Your life can be changed through pelvic floor therapy. And of course, I would love to work with everyone in the world, but that would be impossible, right? And it doesn't even matter. Like for me, if you can work with me, then beautiful. But if you can see a pelvic floor therapist and still get the results you're looking for, that's all I care about, genuinely. And so, but yes, we know that a lot of us struggle with bladder leakage, bladder urgency. So urgency would be when we get the urge to go to the bathroom, and we have to rush to the toilet. Does anyone here experience that a little bit?
I have clients who do.
Yeah, okay, so yeah, so we have some people that are familiar with that, at least, or have some people that know that they have that. Incomplete emptying could be one, where the bladder they're like, it just doesn't feel like it's empty, or they get up and they leave the bathroom and then they have to go back in 10 minutes, 15 minutes, or 30 minutes. And that is a little bit of a incomplete emptying issue, or maybe a frequency issue. So frequency can be if you're always running to the bathroom every 30 minutes, every hour, that can be something that can be a problem too. Bladder prolapse, of course, can be an issue. We talked about that already. Those are just a couple things that can go on with the bladder. There's obviously overactive bladder that Dr. Mary started to touch on already. There is interstitial cystitis that can be obviously very much impact the bladder. Next thing, going on to more gynecological, so vaginal dysfunction. So we can have obviously uterine prolapse that starts to come down. We can also have pain with intimacy. So this can be due to a myriad of factors. Did you want to share, Dr. Mary Star, about your experience, or
Sure,
did you?
sure.
I don't want to, no pressure, of course, but yeah.
Permission, or you want me to share?
We can both do it. Yeah,
Okay,
yeah,
okay.
let's do it.
Okay, so I came in to see her because I was having a lot of vaginal dryness. I was having pain in my hip.
Yeah.
I thought something was happening, and when we went through this, we realized that actually I'm okay. We checked all the pelvic floor, very wonderful, thorough exam, safe, felt very comfortable. and just realized that I actually just needed estrogen, estrogen
Exactly.
cream, in that area too. And so we can talk about my hormone journey another time, but I have had no issues.
Wonderful.
And it's been amazing.
Wonderful. Yes. Thank you for sharing that. Yeah. So yes, go ahead.
You could tell that someone needs estrogen just by looking at it.
So I do something called a Q-tip test. So it is partly by looking at it. Actually, let me grab my model. So this shows the inner labia, and then there's something called the posterior fourchette, which is essentially where the inner labia meet at the very bottom. And then we've got kind of the skin right here. And this whole area from right above the urethra to the very bottom, that's called the vestibule. So the Q-tip test for us as pelvic floor physical therapists, we kind of open up through the inner labia. We take a Q-tip and we actually touch inside. I can't show you exactly on this model. We touch the tissue on the inside. And sometimes visually, like to the eye, it literally looks like really red and angry and just like irritated. Like the skin doesn't look happy. And then it's confirmed by the touch. If the person is like, oh my gosh, like, yes, that's super painful, then we know there's something going on tissue wise. And so in Dr. Mary Starr's case, her pelvic floor muscles were actually perfectly fine. They weren't tense. The muscles themselves weren't painful. It was literally just her skin that was like really irritated and red there. And when she started using the estrogen and obviously to this point, like has had no issues from there. Now, obviously I'm not a gynecologist or an OBGYN, but I do, and I can't prescribe estrogen, but what I can do is just say, hey, this is what I'm noticing. Why don't you make an appointment with your provider and have them also do an assessment and talk to them about if it's appropriate for you to have that prescription for topical estrogen. Especially, so this is actually something that a lot of women can benefit from, not just around perimenopause or postmenopausally, but actually around childbearing age years too, because there is something that they're actually, it's very new in the research, but it's called genitourinary syndrome of lactation. And so what that means is that when a mother is lactating, when she's actively breastfeeding, her hormone levels also drop and her estrogen drops. And this is something I see in the office all the time, where moms will come in after they've given a baby a few months. They are extremely sensitive here, painful with sex, and they can do super well with estrogen. And so anyways, that was a very long roundabout answer, but to answer your question, I can tell if the tissue is irritated by just visualizing it. Most times. Sometimes it doesn't look like anything different, but it's just still sensitive to the touch. And then even in that case, I'm like, ooh, we got to get some type of moisture there. Another thing I do too that I like to recommend, I don't have any with me, but I have some in the clinic, is there's a vaginal moisturizer that I love. It's by the company called Good Clean Love. And they have hyaluronic acids. They have a moisturizer. If anyone's heard of hyaluronic acid like for your face, it's literally for your vagina and it's meant for your vagina, so it doesn't burn or anything like that. I always recommend a spot test first, of course, just to be sure. But the hyaluronic acid has been shown in some research studies actually to be quite effective. I think from what I understand, they've seen that it can be sometimes just as effective as estrogen. So if someone cannot use estrogen from history of breast cancer, or breast cancer runs in their family, or maybe like gynecological cancer or something like that, then any type of really good high level vaginal moisturizer can also be very, very, very beneficial to this area. And I've had people that I give samples to in the clinic and they're having pain with sex and they're like, yeah, I'm not comfortable with estrogen. So I'm like, okay, here, use this. They come back and they're like, it helps so much. So it can be a huge clean. Yes, Good Clean Love. And then it's called, I want to say it's called BioNourish, I want to say. But if you just search their vaginal moisturizers, you just want to find the one that has hyaluronic acid in it. All right, next.
Can
oh,
I
yes.
do a plug too for a product?
What?
Can I do a plug for a product too? Okay. So, and everyone can experience this. This is called Clariderm. With a lot of my guests who are watching probably know Young Living's Clariderm. This was made by Mary Young when she was having twins and when she was pregnant in her 50s.
Wow.
Yeah.
Wow.
And so what has been researched through the years is myrrh oil. Myrrh, we know, was brought to baby Jesus. Why was it brought to the kings and queens of the time? They used it on the perineum in childbirth. It's because it helps the tissues so much. So this, you can smell in this, you can put it on your hands. It's wonderful for any skin conditions, but a lot of my clients who just need a little bit of moisture or have a little bit of just irritation and stuff too, which we can get from anything from traveling and stuff. You can rub it in your hands. It's kind of,
I see that.
yep. It's a more costly because
Is that what myrrh smells like? Is that it? Mostly myrrh?
myrrh, and it has something called clary sage in it, which is a great hormone balancer too.
Awesome.
Too. Not probably to replace what you have, but just it's great to have on your shelf. And then my little guy who gets irritation too. So men, women, and stuff like that it's a great product to have.
Yeah.
As well.
How are we doing?
Did you want, was this for me to make notes or?
Yeah, everyone has it. If you want to make notes, this is for you to keep.
Thank you.
You to
Okay,
keep.
okay, thank you.
I do, when you get into colon stuff, I have a question for you.
Yeah. Okay. Yeah. Well, that was next actually.
Okay.
So, let's see. So we talked about sexual dysfunction. So, I just to touch on a few other pieces with sexual dysfunction. So we can have various types. So we did talk about hormonally mediated, essentially, dysfunction, which is where the systemic, so the body's levels of estrogen have been lowered, whether that is through breastfeeding or whether that's just through the natural kind of consequences, I guess, of menopause or that perimenopausal stage. Sometimes it can be neuroproliferative, goodness, can't say that word. That is just referencing the nerve endings in that area can be very, very sensitive. Or sometimes it can be pelvic floor muscles, the actual muscles at either the opening of the vagina here or the deep pelvic floor muscles here can be really sensitive. And so these muscles can either be too tense and they're just holding into a contraction all the time and they don't know how to relax. They just, for various reasons, it can be due to an imbalance in the hips. You know, it could be due to chronic ab gripping or chronic glute clenching. Poor posture. It could be due to physical trauma, childbirth could, if there's like muscle tearing, very many different reasons can cause these imbalances and overactivity in these muscles. But I wanted to touch on a couple of things that there's a couple of differences between for sexual dysfunction. So a big one that I see is initial insertion. And so that's where someone when the partner or toy, finger, whatever it is, initially goes in, that's a lot of pain right there. Or deep thrusting or deep movement, and that can be really painful too. And both of these can be, if it's not necessarily like neuroproliferative or if we're not using, if we don't need estrogen or something like that, if it's pelvic floor muscle related, then it can be very much treated by pelvic floor therapy is the point I'm trying to make right here. So yes, so I work with people all the time that have pain with intercourse, both initial and deep, and it seems like every week, have these wonderful wins from my patients where they are feeling better, with pain with intimacy. And so,
and I'm going to say this here too. Why this is so important too is because I'm in a married, like this is important.
Yes.
And I feel like this could tear up marriages.
Oh yes, I've heard that in my office before. Yes.
So like.
Yes, I know. I literally I've actually had people tell me before, like sometimes people tell me things that they don't tell their husbands or, and I feel very honored and entrusted by that information, but it's also like, wow, like obviously they feel safe enough to share, but I've had people tell me like, yeah, like this is deeply impacting my marriage and I am very much, my husband is upset with me and I'm suffering because I want to be able to do this and I can't and it just kills me, and so yeah, so it can be life-changing, which is why it makes me so which is why I'm so happy to be able to do this work because it's such a wonderful privilege to be able to do this work. So anyways, not me crying here, but anyways, all right, let's move on to more rectal dysfunction. Okay. Number 1, constipation. If you are chronically constipated, believe it or not, that could be your pelvic floor. And that is because if we think about it, your pelvic floor needs to, once again, right, squeeze when it needs to squeeze, it needs to relax and open when it should. And sometimes we have people that have something called dyssynergic defecation, which what that simply means is that they go to push when they're sitting on the toilet and they actually end up squeezing instead. And I actually see this pretty often in the clinic. And we have to retrain these muscles to know how to appropriately push and like expel and bear down and all the things. And so also if you're chronically constipated and you're always straining and pushing and just like on the toilet, that can over time, put a lot of pressure on your pelvic floor and not necessarily be the greatest on your pelvic floor either. And sometimes that can lead to other issues like prolapse and things like that. On the opposite end of the spectrum, we have fecal incontinence or gas incontinence, which is essentially when someone cannot control their stool or they cannot control their gas. And that is something that can greatly be improved through pelvic floor physical therapy. I have worked with multiple people at this point now who have had fecal incontinence, and I've seen tremendous, tremendous improvements to the point where they don't have it anymore. I mean, they have overcome fecal incontinence and gas incontinence. And that, as you can imagine, I mean, if we think about how embarrassing it is to, or for, I'm sure for a lot of us, right? Even though sometimes it is normalized, and I have a bone to pick with that, but that's for a different day. It can be embarrassing to pee yourself if you're accidentally peeing yourself, right? Of course, you're not meaning to, if you're coughing, sneezing, laughing, jumping, all the things. But imagine if you literally poop yourself, think about that. That's almost so much worse, it's horrible, horrible to feel like you can't leave your house. I literally have a patient I'm working with right now. She felt trapped to her home. Like, I don't even want to be in the car. I don't even want to go out to a doctor's appointment because what happens if I get this urge to use the bathroom and I literally can't make it and I have an accident? So that's a huge thing. So that is a big thing that I work on in the clinic as well. And also, we talked a little bit about the rectocele. So that is when the back wall of the vagina, the rectum, is kind of pushing into the back wall of the vagina. It makes a little pocket, and it can sometimes make emptying pretty difficult. But prolapse is one of those things where honestly, it can be so well managed through physical therapy. It really can be. I actually was just talking with a colleague yesterday, and she was saying so there's 4 stages of prolapse. So number 1 is the most mild, the littlest amount that you could have. Number 2 is like mild to moderate. Number 3 is a little bit more moderate and severe, I'd say. And then 4 is like completely out. We do need, I mean, not like down to the ground, but essentially that organ is out of the body. And we do usually need surgical intervention at that point because of risk of infection, tissue breakdown, things like that. But before, the research was really supportive for stages 1 and 2 being really, really, really helped by physical therapy. And now they actually just added in that even stage 3 can be, really, really supported through physical therapy. And I see prolapse like no tomorrow in the office. And it's a thing that can truly be life-changing when you get over those symptoms, and you're feeling better. Yes.
Okay, so question came in, can prolapse happen in young children or only in older women? I have an 8-year-old daughter who has had issues with constipation for about 4 years. I'm wondering if that might be connected. We've tried so many things to help her.
So that is a good question. My answer, I will preface this by saying that I'm not a pediatric pelvic floor therapist. There are pediatric pelvic floor therapists out there, and so you would get a better answer from them. I do believe the answer is yes. Yes, I do believe that the answer is yes, that even young children can experience prolapse. And that's just simply because of the amount of pressure that would be going down on the child's pelvic floor over time, just unfortunately that chronic of the constipation.
I had a good friend, her granddaughter at 6 had
baby. That's tough.
And
I will say that, so I do, from what I've heard, like I said, I'm not a pediatric pelvic floor specialist, but from what I've heard, I do believe it can happen. If you haven't already, if there is any opportunity to consult with a pelvic floor therapist that is a pediatric specialist, would definitely recommend. And then also, to answer the other question is, does it only happen in older women? If that's referring to older as in like 60s, 70s above, the answer is no. I see it all the time. I see it I have prolapses myself. I do have a baby, but I had a prolapse even before I had a baby. And I found that out from other pelvic floor therapists. Yeah.
wow.
Yeah. So I have well, I guess I have because it is there, but I don't have any symptoms though. And so I found out because I was, they were doing a pelvic floor assessment and we had the mirror and I could see the mirror, so I could see myself. And sure enough, when they tested for prolapse, there it was. And so, but once again, no symptoms. I did have some mild symptoms after I had my baby. I was walking too much immediately after I gave birth, and I had some heaviness. And but once I cut out the super tight cinched waist, leggings, and I rested on the walking, and I gave myself more time, and I healed up well after I gave birth, and I've had no symptoms ever since.
Question.
Yes.
Super tight cinched leggings
Yes.
or tight clothes.
Yes.
Could that contribute to our?
So I think that's a really good question. There are some pelvic PTs that would tell you yes, that it can absolutely contribute to pressure going downwards. There are some pelvic PTs out there that would say no. So I'm kind of in the middle. So I will say this. I think that it can exacerbate symptoms. Do I think it can cause a prolapse? I don't think so. I think prolapse can be caused by more of the what's happening internally in our body, or like the chronic straining or maybe heavy lifting if we're not using appropriate breath strategies, if our core and our pelvic floor aren't coordinating in the right way. I know for me for sure, when I was wearing really tight, kind of like shorts with like a really tight spandexy waistband, I did feel worse afterwards. That was the symptoms. I don't think it caused it though. Does that answer the question?
Yes. And another question was from a woman who has 50 plus pounds. Because I know when I lost my weight, I started exercising, I stopped peeing my pants.
Yes.
But a woman asked who has they call it a belly apron.
Yes.
And stuff, is that contributing to a lot of pressure and symptoms?
It can. Yeah, it can. Unfortunately, I hate to say it, but it's true that the research does show that just obesity, especially with morbid obesity, it can make incontinence a lot tougher to treat as far as with pelvic floor therapy. And some women do find that when they lose weight, their symptoms get a lot better.
Okay, we'll talk about that at the end.
Yeah.
Another question came in: hysterectomy from cancer. I think there must be prolapse, strain from gas. How do I find the best person?
Ooh, that's a good question. So, I have lots of thoughts on that. Okay. Find the best person. So I would say, if possible, look for someone this is what they do day in, day out. I would say that's probably my best piece of advice is there are some pelvic floor therapists that just due to the nature of their work setting, they have to kind of split their caseload. So maybe some of their caseload is pelvic health, some of their caseload might be neuro or neurology based, or some of their caseload might be orthopedics, etc. Some pelvic floor therapists, honestly, in the world of pelvic floor therapy, there's not as many regulations, and the reason why I say that is because yes, you can be certified as a pelvic floor therapist, but you don't have to be to treat pelvic floor. And sometimes people don't have. Sometimes people have just kind of dabbled in it a little bit. If that makes sense, and they just maybe taken a course here or there, but that's not like their actual passion. So they may not know as much as maybe the next pelvic floor therapist. So I would say try to find someone that really this is what they do. They work with people post hysterectomy. They have experience treating prolapse. Look at their website, look at a little bit about themselves, and then maybe even if you have a chance, on that first visit, when you go in to meet with them, ask them, say, hey, what's your experience? Kind of tell me a little bit about your training in the pelvic floor. Tell me about, have you seen this before? And hopefully you'll have something that's honest and will tell you appropriately, yes, I treat this all the time. I have great success, or I'm a little bit more of a newbie, or I just started in this, but that would be my best piece of advice is to really look for someone that.
I'm sorry,
It's
I didn't
okay.
interrupt.
No, go ahead.
If you're seeing your OBGYN on a regular basis, once a year,
yes,
don't they know if you've got prolapse without, and wouldn't they say you need to see a pelvic floor?
That's a great question too. Yeah, no, I know.
Can you repeat it?
Yes. So the question was, if you're seeing your OBGYN on a regular basis, and once a year, they're doing the exam, all the things. Shouldn't they tell if you have prolapse, and wouldn't they recommend you to a pelvic floor therapist? Well, in an ideal, perfect world, they would. They would say, hey, you've got a prolapse and you should go see a pelvic floor therapist. Here's the thing, I have a multi-part answer to this. Number one, some people have prolapse, they don't even know it. They don't even have symptoms of it at all, and they're living their life perfectly fine. And in that case, do they need to see a pelvic floor therapist? I mean, I think if you're fine, then you're fine. You know, it's not, prolapse is so incredibly common. Like, I think that one of the stats I read recently was that like 60% of women have it. Like it's like incredibly common. And I think 50% of women that give birth vaginally will have a prolapse as well. I did see research that showed that, remember the stages I was talking about, 1 through 4? They're showing now that stage 1 is so common after vaginal childbirth that they're considering it within normal limits, like literally just a normal anatomical change to the tissue. So second to the piece to answer your question of when your gynecologist recommend you to pelvic therapy, we need to educate, us as pelvic therapists need to continue to educate OBGYNs more on, hey, this is what we do. This is how we can help your patients. This is all the ways that we can change their life. Because a lot of times OBGYNs, they either don't realize that their patients could benefit from this type of therapy, or they don't even know what it is. And that's something that is on kind of us.
So I want to make another comment on this too, because I had a 72-year-old who went to her primary doctor, said, I just feel like something heavy down here, thought she would get some help. Oh, you're fine.
Oh, no.
You're fine.
Oh, that's awful.
Lived in misery another 6 months.
Oh, no.
And then finally went to OBGYN, sent her to, I think it was urologist, and she had a urethral prolapse, and just had surgery on that too. So I think we need to be advocates
1,000%,
for ourselves.
Yes, 1,000%. Yes, that's
Dade City, aren't you?
Wesley Chapel.
Wesley Chapel.
Yes.
Okay.
So yes, I want to speak on that for a second. That yes, if you are having pelvic floor dysfunction, and you know it, definitely press your doctor for a referral. In the state of Florida, you don't need a referral actually to go directly to a physical therapist. At least for my practice itself, which is Bliss Pelvic Health, we have people come to us all the time without a doctor's prescription. The way that we kind of satisfy the legal requirements of the law with our Practice Act as physical therapists is all I do is I just write the note for the initial evaluation. I send it to the doctor for them to sign it. And essentially, once I've sent it officially to them, it is now out of my hands and it is in the doctor's hands to send it back to me. So, but yeah, the point is that advocate for yourself. Go see a pelvic floor therapist if you have the resources, etc., the time, all the things. But yeah, there's so much more. I could go into core, all the things, but how to have a healthy pelvic floor. But I don't want to take away from the nutrition piece too.
Yeah. One question.
Yes.
Is explain a little bit when they come to see like the 5 parts, because I'm going to send them the videos.
Oh yeah.
But explain like the 5, I call it 5 parts or 3 parts or whatever.
For the first visit?
Yes.
Oh yes. Okay. Yeah. Okay. So yeah. So at our clinic, Bliss Pelvic Health, we start with an initial evaluation. It is 90 minutes long, and we do that very intentionally because I want to make sure that myself and any other provider, pelvic floor therapist that is within our team is having sufficient time to hear your story, to really listen to you, to really absorb what you're sharing with us and take it in and ask all the right questions and dig deep and really take time. And so that usually alone, that conversation is most average about 30 minutes long. So that takes up, boom, 30 minutes of the 90 minutes. After that, I typically do an orthopedic screen depending on what they're coming in for. So if they're coming in for some stress incontinence, that would be like leakage with running or jumping, let's say, or coughing, sneezing. I will look at their rib cage. I'll look at their tummy, their spine, maybe even their hips. If they're having issues with running, heaviness with running, I might look at, how their foot's striking the ground, what their glute strength is like, their hamstring control, all the different things. After that, we talk about the option of a pelvic floor muscle assessment. And what that entails is I will sit down and I'll actually say, okay, Lisa, what we're going to do today is, or if you would like to do this today, this is what it would look like. And I'd say the first thing I'm going to do is just observe your vulva. And so I'm going to look for things like skin irritation that we talked about a little bit before, redness, anything that looks like a rash. You would not believe the amount of rashes and skin diseases literally that I've caught in my office. I mean, I feel like every other week it's something. And I'm always sending out to the providers like, hey, like, see your patient, like they've got something going on. And sure enough, they do. So I always start with observation. After that, I go through functions. So functions would be I open up through the inner labia so I can see the opening of the vagina. And I say, give me a Kegel. So give me a squeeze of your muscles. And what I'm looking for is, do the muscles in fact squeeze? Do they also let go? Because we talked about how sometimes the muscles, they may be able to squeeze, but they may not be able to let go, right? So that's important too. So I'm looking at a squeeze and a let go, and then I'll have them push or bear down for me. So I will say, can you push? Like you're trying to pass gas, or trying to push my finger away from your vagina, anything like that. And I'm looking for that function too. After that, if they say everything's good and we're good, then we'll move to the internal assessment. In my, I think I might need some water. Sorry. Excuse me. Sorry about that. My voice just caught up with me there. Or the dryness caught up with me. All right. So after that, I go over the internal assessment portion of things, which is one finger and one finger only. Of course, my hands are gloved. And we start right at the opening. And then the way I always do it is I say, okay, once I'm there, I say, is it okay if I insert? I'll insert on your okay or your yes. And then they say yes. And then I go to just the very tip of my finger. So just to the tip of my finger. Oh, thank you so much. Thank you. 1 second, guys.
And this is also in the videos that we have.
Yes, yes.
Yeah.
And then after that, we move to the first knuckle. So think about my first knuckle is inside. From there, I will start to assess what we call the superficial or the first layer of muscles. What am I looking for? I always tell people I'm just trying to gather or gauge information about your muscles and how they're functioning. So I'm looking for things like, do the muscles feel tight? Do they feel tense under? Is it hard to like kind of gently pull them a little bit, or feel them? Do they feel like they're just like stiff, or do they go really easily? Like I want to know what they feel like. I want to know if someone has pain. That's a huge thing. If they're coming in for pelvic pain or pain with intimacy, are you having pain with anything I'm doing? So I will kind of go all the way around the clock is what we call it. So if you think about at the very bottom here, this would be 6 o'clock. Up here would be 12, which is where your urethra is. I never push on that because that's not comfortable. Here, okay, so hold on. This side would be 3 o'clock. I know it's reversed for you guys. And then this side would be 9 o'clock. So I'm checking all the muscles essentially. So you would hear me say 6. Okay, we're gonna go to 7. How's 7 feel? Okay, 8. And then I go continue on. After that, the second layer is the periurethral muscles. So what does that mean? That means the muscles that support the urethra and the bladder. So those are super important, right? If you're having any type of bladder leakage, we want to make sure that these muscles are coordinating and they're turning on, they're contracting. So the way that I test that is I kind of snug my finger up. I can't do it on this model, but essentially I snug my finger up towards one side of the urethra and I'll say, hey, squeeze around my finger. Can you let it go? I go to the other side, squeeze around my finger, let it go. I go to the middle, so right underneath the urethra. Can you squeeze and let it go? And then last but not least, full finger inserted, I go to the deep layer. So all these muscles right here. So I'm feeling on these muscles and these muscles, so the right and left sides of the pelvis, okay? And once again, things I'm feeling for side to side are, can you squeeze? Can you let go? Do the muscles feel super tense or do they feel nice and soft? Do they feel like they can contract well? Do they feel like there's no contraction at all? If that's the problem, if that's the case, then that's a different issue. And then we're also looking at the hip positioning as well. And so I might test things like strength and coordination, endurance. Those are other things I often look at too. But that's pelvic floor muscle assessment. And then by the end of that, by the time we finish that, then what I'll do is I will start to give my homework and my recommendations. So homework might be, hey, let's work on relaxing your pelvic floor. Hey, let's do these stretches. Or I want you to do this as far as for your bladder. Let's stop drinking carbonated water because the carbonated water is making your bladder irritated and it's making you rush to the bathroom. I'll give you all of my tips and tricks and things. I'll give you all the things for the first session. And always, 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 my goal is to be able to let you know 3 things, okay, on that first visit, which those 3 things are what I believe is causing your symptoms, why I feel like you're experiencing them, and lastly, how we are going to get you feeling better and get you to where you want to be. And that's why it takes 90 minutes. So that is my full eval. And then, of course, I recommend a treatment plan from there. So a treatment plan is anywhere from, most people usually see me around 10 to 12 visits or so. It averages though. Some people are less, some people are more, it really just depends. And I do like to see my patients weekly. So I like to see them just 1 time a week. And yeah, that's a little bit about pelvic floor therapy and about me.
That's
So
amazing.
yeah.
That, I mean, just so many good
Oh,
things.
we have a question. We have maybe a couple questions.
Okay, sorry.
Oh,
Do hemorrhoids have anything to do with all of this?
Yes. Yes, I think so. I would say so. Obviously, if they came from like pregnancy or childbirth, that can be one thing, but like if there's consistent straining and pressure, that could be a contributing factor to the hemorrhoids. And so, especially if the hemorrhoids are getting like really irritated when you are having bowel movements, then my thing would be looking at like, okay, how are you breathing while you're pooping? What's your stool consistency like? Is it really like rocky and pellety, like kind of like goat pellets, or is it more like a smooth sausage or a ripe banana? I would want to look at your position of your feet even. Are you using a squatty potty or a step stool to elevate your feet? Are we doing abdominal massages to kind of get some peristalsis and get the GI system moving? And so with the hemorrhoids, yes, I do believe that there are ways that we can kind of help reduce the irritation and reduce the like severity of like the pain and discomfort. And that would be through helping disperse pressure throughout the whole body. So what do I mean by that? Is working on things like thoracic mobility, working on rib cage expansion, making sure we're breathing really well, diaphragmatically breathing, different things like that.
Awesome.
Yeah.
Awesome.
I know you had a question too.
So when someone has a prolapse,
yes,
and let's say they don't have symptoms, is it possible to get the prolapse to go away, like lift up to back to the prone position? That is possible?
So in research, they show that physical therapy can help reduce by one stage. If you have a stage 1, you can get it to a 0. If you have a stage 2, you can get it to a 1, et cetera, et cetera, et cetera. It does depend on many different factors though. Like it does depend on how many children you've given birth to, what your bowels are like, are you straining on a regular basis, things like that. But honestly, the way that I like to think about prolapse is just that it's just a change in laxity. That's the way I like to think about it. So if you don't have symptoms, I like to think, can we be more preventative? So can we just make sure that we are having good breath strategies when we lift up a box or something heavy, or if we are weightlifting in the gym, then we make sure that our cores are nice and strong, so we can support our pelvic floor, things like that. But to answer your question though, there is some research that that does show that you can reduce it up to one stage.
Okay.
You're welcome.
I think too, one of the things I want to share from my experience with you too is that, I mean, I knew some for the exercises and stuff.
Yeah.
But some people are like me where they're not going to need 12 to 14 visits.
1,000%. Right? Exactly. Oh yeah. Oh yeah. Yes, that's a great point. And just to speak on that for a second, I always tell my patients, like, for me personally, this is how I am. Like, if a person comes into my office and they do not need my services, then I am not going to recommend my services to them. Like, I had a patient actually that happened to, where we did a full exam with full evaluation, 90 minutes, and I did the most thorough, like I looked at everything and could not replicate her symptoms, could not find anything, like everything was checking out normal, but she was still having symptoms. And I was like, I just feel like this is more of a medical issue. So I sent her to an OB/GYN. And so, and interestingly enough, the OB/GYN just texted me and she was like, she came in, I did my exam, but she didn't have the symptoms right when when she was in my office. So now we need to wait until she has the symptoms, and then we can do a biopsy, and then we can figure out what's going on. So, so yes, so some people will not need 8 visits or 10 visits or 12 visits. It just depends on what the person needs, and I'm very sensitive to that. I will always, or I will only recommend what's appropriate to somebody.
So one of the things I want to recommend as a former chiropractor too is chiropractic care.
Yes.
Is the nervous system when these joints, including the SI joints and the sacrum, and the nerves that innervate all of these organs. Because sometimes the irritated organs can actually cause pain into the joints too. So it's such a great preventative tool to use. But for me, I was getting the chiropractic care and this wasn't going away, right? And obviously it's not going to cure vaginal dryness and stuff too. So that was really amazing. But I want to share a story with you too. It's not a pelvic floor story, but it is based on that. So I was health coaching she's about 65 years old. And just like you said, go shopping with her friends. literally would have to buy new clothes because just she couldn't make it to the bathroom. Poop, pee. I mean, it was just horrific, right? I started seeing her in December. She came in after being at the hospital with terrible gut issues. We started with one simple natural thing in her water every day, stop the bloating, stop the gastric stuff. It was amazing. And then we introduced you, many you, maybe Nick, you've not heard about it, or some of you, we have a program called the Reset or Rev Up, where we teach people how to make lifestyle changes, particularly in food, right? Our Rev Up program teaches about 4 cups of veggies a day. And we teach that, which changes the microbiome. Right, which can be a piece of this too, which here 100%. Dr. Kelsey does microbiome tests, and she can test people all over the world. Your gut poop test, which can make a difference. But because all of that, and then she tried, I want to ask you about this. She tried bladder Botox. She said it did not work for a few days. But she believes we start her on high doses of the Ninja Red. So it's high antioxidants, the goji berry. She believes it was the Rev Up, the Ninja Red, this combination. She's like, I don't have to wear Depends anymore.
That's awesome.
Like her life has changed.
Amazing.
And stuff too. But do you have any opinion about Botox?
No, so I have a little bit of experience with it, not a ton. But for me, my experience is more Botox in the pelvic floor muscles.
Yes,
themselves.
Okay. That's what she had pelvic floor bladder for an overactive bladder.
Gotcha. Okay. Yeah. So I know for bladder, sometimes they'll do like different like procedures with the cystoscopies, or they'll do installations in the bladder, things like they kind of coat the bladder with different things. But I haven't had too much experience with that. I've had experience more with like the muscles. And for my particular patient that she went to get the Botox, it didn't really work for her. Either. Yeah.
And I just have to share, friends, like, you hear me talk a lot about Ninja Red. Ninja Red's a very, very high antioxidant, but it's got minerals, and it's like this whole food superfood that when you take these higher doses, because I took it for years at lower doses, and my hair, my skin, my moods were all, but when you take these higher doses, we're seeing people with overactive bladders. We're seeing just great because you lower the inflammation so much. So that was really just what I kind of wanted to round up with, is that when we are treating the foundation, right? So I made this post today that says self-care is not selfish. We must care for ourselves, or someone else will have to, right? Someone else will have to. So, coming to see you, which is cash-based, or investing in the Ninja Red, which is not going to be covered by insurance, our Rev Up program, investing and putting money aside for your health is so important, and what would you pay what would this woman pay to not be peeing herself? What is she going to save on Depends alone?
It's true.
Right?
It's true.
Like in the quality of health that she can get back. But a lot of my over 50 women, they want to be able to have sex again with their husbands, and they want to be able to feel good and not be peeing themselves. And like, this isn't normal. Like, we don't have to accept that. So I would love to invite you, if you are in the area, and even if you're not, Florida is a great place to come visit and hang out, and maybe even, because there's going to be people who live not even 6 hours from a pelvic floor therapist, right? So this would be my question too for you is, what if someone like we have snowbirds here who are only here for 6 months.
Right.
So you could probably get a lot done in 6 months.
1000%, yes.
And then we have individuals who come for just like a week or two. Could they come and see you anyway? Okay.
Definitely. Yeah, absolutely. Funny enough, actually, I have someone that I was just talking to yesterday who crazy, but they live in Panama City, Panama.
Wow.
And they somehow found out about our clinic online on some type of support group. And they were looking for a pelvic floor therapist in either Orlando or Tampa. And she's making plans to come in March, actually.
Wow.
Yeah. So definitely. So to answer the question is yes, you can definitely, I would say I do love my in-person assessments because I get to, really take a look at that person and put my hands and touch their body and really feel what's going on. But then we can always continue it virtually if we need to, or if there is a point where once again, like I'm the type of person where if I feel like genuinely like I've kind of met my limit where I'm like, this is about as much as I can help you virtually, then I will look in your area for a pelvic floor therapist that I feel like, let me pass that baton on and have you continue care with them.
So awesome. Yeah. Awesome. So what does it cost currently in March, the end of February, 2025.
Yes.
So people might be watching this 5 years from now.
True.
But what is the cost right now to come see you?
Yes. So right now, our initial evaluation for the 90-minute assessment is $249. And then after that, what we do is we recommend a treatment plan. And the treatment plan, when we do, let's say it's the 8 visits or the 6 or the 10 or whatever it is, we offer a discount off of that as a whole. And then it brings it down to about $200 per visit. But as a thank you for spending this hour with us, I do have a special. And I actually offer that very first visit if you want to do it with me in person. I offered at $125 actually. So it's a 50% discount.
I said no. I said no, you're not gonna do that. You're not gonna do that because that is ridiculously generous.
But I want to make it I understand that's an investment, and I know that not everyone maybe has those resources, but that's why I say, like, even if we can just do the first visit just to like get you some guidance, just to get you some clarity, just to get you some direction, then that's it makes my heart happy. So
that is really, really wonderful. If someone wants to work with me for 60 days, we have a health coaching program if they are like really struggling and stuff like that. Mine is $150, and that includes about 4 times that we meet either virtually or come to my office and let's hang out and stuff. Awesome. Those who are interested in our Rev Up program, including the Ninja Red package, total is about $165. That includes shipping and handling as well. And that's our 10-day program with the Rev Up program too. And that's a $74 if you just want to dig into the health and learn more about that nutrition too. So I want to thank you so much for coming. You are just a gift to our community. Weren't you ranked top #1 pelvic floor therapist in this area? You're just
we have the most reviews in Pasco and Hillsborough County, 5-star reviews.
And I love your wall of wind. To see that. I want to thank all of you for coming.
Thank you guys.
Thank you all of you for watching today. And if we'll get this up available on YouTube. So if they have questions, they can email us as well. Oh, how do they connect with you? Let's just say it out loud too.
So our company, it's a family owned, my husband and I own it. We are called Bliss, BLISS, Pelvic Health. So if you Google us, you can just search Bliss Pelvic Health, or you can go to our website, which is blisspelvichealth.com. And then I'll also put our phone number, I'll say our phone number, which is 813-993-4212. And if you do end up calling in, you'll end up speaking with our receptionist. If you want to come in for that first visit, just make sure that you mention that you attended this workshop, and our receptionist will honor that $125 rate for you. Okay.
Yeah. One thing I didn't say too that I want to really compliment your business is how professional it is. And from the emails that I got and the videos that you walk us through it, because it's a very scary thing for women. But I love just the professionalism from the moment, till we leave, and it's just really, really amazing.
I appreciate that.
Thank you, Dr. Gabi.
Thank you.
If anyone wants to connect with us, you can reach us at www.starhealth, STARR, 2 R's, health.com online. And thank you.
Thank you,
everyone. Say bye-bye.